Hello everyone, this is Pharma 1, video 1. I'm going to be discussing aminoglycosides. And aminoglycosides, what are they? Aminoglycosides are antibiotics, okay? And they treat serious gram-negative bacterial infections, okay? What do they treat? Gram-negative bacterial infection and some gram-positive bacterial infections too. Some. We're not going to go in detail about them. All aminoglycosides, they end with mycin. 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 Remember, your sin. You committed sin. Mycin. Okay? All aminoglycosides, they end in mycin. Mycin. And so what are the names of some aminoglycosides? Aminoglycoside, how to remember this? Make a song about it. I used to make songs in nursing school. Some of my friends can say about them. So I say about that. So this is how I make it. Genta tobra vancomycin. Genta tobra vancomycin. Gentamicin, tobramycin, vancomycin, neomycin. This is how you remember. Gentamicin, tobramycin, vancomycin, neomycin. Genta tobra vancomycin. These are aminoglycosides. Now some drugs, they have an ending which has the same ending, mycin, but they are not aminoglycosides. And what are those drugs? You throw away those drugs when you see them, and they actually have a throw in it. Okay, when you see this drug, I say this has a mycin, but it also has a throw in them, so you throw away. These are not aminoglycosides. Aminoglycosides doesn't have a throw in them, and the fake mycin has a throw in them. So you distinguish that. That's how you distinguish. Some of the throwaway medication are azithromycin, erythromycin, clarithromycin. Azithromycin, clarithromycin, and erythromycin. These are not aminoglycosides. Adverse effect and toxicity. Certain things that you need to remember about aminoglycosides: they are severely toxic to your ears and to your kidneys. So they are ototoxic, nephrotoxic, ototoxic, nephrotoxic, otonephro. They also cause photosensitivity. They also cause photosensitivity. So you don't, if you see those, you stop the medication. And there's another one more adverse effect is some patients develop severe they create super infections, which is pseudomembranous colitis, okay, which is C. diff basically. And you know how you distinguish C. diff? Their poop is gonna smell horrid. It's gonna be, you will know that a person has C. diff if you're standing 3 rooms away from it, or from them. They will have, you can smell their poop 3 rooms away. So that is C. diff. Okay, and how do you treat this person? You stop this medication and you give them PO flagyl. PO flagyl. One more thing I forgot to mention is these drugs are administered IV or IM. Aminoglycosides are given IV or IM. IV or IM. And one medication, specifically neomycin. Neomycin is given PO for bowel surgery. When your patient is having a bowel surgery, you give them PO via your mouth, and that is because to make the bowel sterile. Okay, so and how would you? They will say you will have an order of check the peak and trough. So how would you check a peak and trough of a medication? So for peak, you check for this medication. You check 15 to 30 minutes after the infusion is completed. So you're giving in this medication, gentamicin, and you want to check the peak. Once this medication is finished, you will check after 15 to 30 minutes. You will check the peak of this medication, and you draw blood. You send to the lab, and you say peak. I want to know the peak, and they'll tell you. And how would you check the trough of this medication? 30 minutes before any IV dose, before the next IV dose. So your patient got today, and then you want to check the trough of this medication. So before you infuse 30 minutes, you draw the blood again and you give to the lab, and they will tell you the trough of this medication. So a review of this medication, aminoglycosides, and then mycin, gentatobra vanco neo, that when you see another fake medicine that has throw in it, it is not an aminoglycoside. Example of them are erythromycin, clarithromycin, and azithromycin, clarithromycin, and erythromycin. You throw away them when you see them. They are not aminoglycosides. Okay. By the way, look at them. What are they? Tell me. All right. In the comment section, tell me what they are, and what are they considered. What class of drug they are considered. I will be posting another video for pharm. A different class of medications. I'm gonna put this on YouTube and share it to anybody you care. Okay, thank you.